joke in OT is, well, no one knows what we do because we do everything. So I have helped farmers figure out how to vaccinate cattle. I have helped office workers figure out, how do I set up my workstation? I've helped construction workers figure out, how do I pull up in a cement truck? So I do a little bit of everything. Helps the body move, OT helps the human do. So PT is the moving and OT is the doing. And of course we overlap, because if you're doing something, well, you gotta move to do it. And usually if we're moving, it's for a purpose. So usually with occupational therapy, the occupation is not necessarily a job. It's anything that occupies your time. So we are very, very skilled at looking at the little Lego pieces that make up how you do a movement. Most people don't think about, how do you go to the bathroom? How do you put on a shirt? You've done it the same way your whole life. But having an OT involved opens the way to a different way of doing things. And how can we change what is difficult to make you more able to do things? You have to live your life. You have to do what is meaningful to you. Whatever occupies your time, that is occupational therapy. So sometimes it's as simple as changing your activity and the way you do things, and you can use that for the rest of your life. I've had people tell me I taught them a different way to open a jar, and they still use it to this day because, hey, my thumb doesn't hurt. That's what I need, is I need to open things that doesn't hurt. Sometimes after a surgery, it's, okay, for right now, here's your little box where you're allowed to live. How do you live the best life within that box? And then your OT can guide you to come out of it, out of those precautions as your doctor allows. First things first, you need to not be in pain. So how can we change the way that you do things? How can we change the way you put up groceries? Can you have somebody help reorganize your fridge so that you're not lifting a gallon of milk, you just get a half gallon, things like that. And then once that pain is under control, we'll do some stretches and exercises. Let's help everybody move as a team together. Let's help just kind of get that rhythm back going again. And once that rhythm is good, then we build up the strength of, okay, now you can start getting a full gallon of milk again. Now you can start lifting a case of water again. You can put up your Christmas decorations. But that's usually the last thing that I work with people on, because you need to not be in pain while you live, and then you have to be able to move. So anything that you feel like there's got to be a better way to do this, that's an OT. Anytime you feel like, why is this suddenly difficult? It never used to be, that's an OT. Anytime where there's a hitch in your giddy up, that's an OT. It's kind of like taking your car to the mechanic. So you take it in regularly to keep bigger issues from happening. And if you go in and be like, hey, by the way, it's making kind of a weird noise, they can fix it. We usually don't want people to wait until you're on your last legs and you have to push it into the shop to go, hey, I think it's busted. Usually we want people to come in before then. So even if it feels like it's small or trivial, that's still something that we can see and help.